The physiological variations of the oral mucosa comprise different anatomical variations, which sometimes border on the pathological, but which are often simply a tissue variation represented by several basic lesions. The first of these physiological variations involves the LINEA ALBA. This is a white line level with the smile line and is caused by friction between the cheeks and the teeth. This creates tissue edema and surface keratinization, which materializes as this white line. It has a corollary in the lingual white line in people who are particularly anxious. Leukoedema is a physiological variation which causes the formation of an opalescent veil on the jugal mucosa. This opalescent veil is caused by tissue edema, again secondary to friction between the cheeks and the teeth. This leukoedema is more marked in obese patients and in patients of colour. Fordyce granules. These are ectopic sebaceous glands which for embryological reasons are found in the oral mucosa, principally on the lips and cheeks. They form yellowish clusters of granules which represent the accumulation of sebum. Stenson's duct forms a small caruncle on the cheek located opposite the first maxillary molar. Palpation of the parotid gland under the earlobe causes the release of a jet of saliva. Coated tongue. This involves the deposition of a coating on the tongue. This coating corresponds to cellular desquamation linked to the biofilm. Scrotal tongue is another physiological variation characterized by fissures which correspond to wrinkles in the tongue. There is often a central furrow and lateral furrows. Macroglossia denotes a tongue that is too large in volume for the space within the dental arcades. It manifests as an indentation of the lateral borders. Geographic tongue is an oral variant of pustular psoriasis. Geographic tongue is also known as benign migratory glossitis. It is characterized by erythematous areas of depapillation, encompassed by a yellowish-white circinate border. The lesions have a tendency to heal and to migrate over the tongue, hence the name benign migratory glossitis. Hairy tongue is characterized by an elongation of the filiform papillae, which are sometimes oxidized by chromogenic bacteria. The blackish color may be darker depending on the patient. Varicosities correspond to varices. They are found on the ventral surface of the tongue and involve the lingual veins. Finally, sometimes tissue may have a sclerous appearance, taking on a whitish color. This appearance is often cicatricial and in most cases is secondary to laser treatment of the oral mucosa. Sometimes there may be osseous swellings which manifest in the mucosa. For example, in the photo on the left, a maxillary torus forming a central mass in the middle of the palate can be observed. Rarely, these tori may manifest in the form of lesions resembling a drumstick, as for example here on the maxilla. Finally, in the oropharynx, there may be anatomical variations of the tonsils and vegetations which appear hypertrophic in the absence of any infectious process. Finally, sometimes mucosal swellings may be secondary to osseous manifestations. For example, in the case of maxillary tori, which form a central nodular lesion in the middle of the palate. Exceptionally, maxillary tori may take the shape of a drumstick, knowing that this form is observed mainly on the mandible. Swellings representing physiological variations can also be observed in the oropharynx, for example in the case of hypertrophic tonsils and hypertrophic vegetations in the absence of any infectious process. Physiological variations also involve mucosal pigmentation. For ethnic reasons, excess numbers of melanocytes or excessive melanin production can be observed in the absence of any infectious process.